Hello again, everyone. Mark Hackle, Macomb County Executive. Just giving you a quick update on the COVID-related issues here in Macomb County, and then I want to bring in a special guest to kind of talk a little bit more about the specifics that are going on here in regards to law enforcement and public safety, our jail. With that being said, the number of cases we have recorded for today is 5,832. That's the number of positive cases that we have thus far. In the unfortunate reality of the deaths, 633 here in Macomb County alone. We are hearing from our health department that the numbers are not only are they leveling off, they're starting to decline, and that's a good sign, albeit unfortunate. People are still getting it, and unfortunately people are still dying from it. Big question, over the weekend was, what about this new governor's order that's in play? She didn't get her state of emergency authorized by the legislature, so she decided to use some other avenue to give her the ability to still keep her, executive orders in place. With that, she also added something that deals with the grocery stores, making sure that people come there wearing masks, and everybody working there wears masks, and even the cleanliness and washing the hands every time they have contact with somebody that comes in to purchase somebody or somebody they're serving. So all of these things are still in place, and one of the most confusing parts about that is the enforcement aspect. Who enforces these things? I can assure you, when it comes to grocery stores, that's the Department of Agriculture. They're the ones that deal with that, and people will call us. They'll call the police department, the sheriff's department, and ask them, hey, somebody's walking the wrong way down the aisles inside the actual grocery store, or we're noticing somebody isn't wearing a mask. You got to realize law enforcement isn't trying to be the social distance police. They don't make the laws. They're there to try to enforce them as best they can, but we're getting inundated with people thinking that every time somebody's within 6 feet or somebody's wearing a mask or not wearing a mask, that they call the police and handle it. Even the Attorney General, Dana Nessel, has put a cautionary note on the enforcement aspect on behalf of her office and saying you need to contact local police. But really, folks, I don't think law enforcement is looking every time you see somebody out on a golf cart calling the police, or somebody's not within 6 feet calling the police. I don't think that's what's necessary. And understand this, our health department is inundated. Like all health departments throughout the entire state, we're getting a lot of people trying to figure out how do we deal with this particular issue. Our health department has stepped up to the plate early on. From our very first case that we had recorded here in Macomb County, March 13th, they got on board and tried to figure out, okay, how do we deal with what's going to be this contact tracing? And that is the number one issue moving forward, is how do we contact people that either are tested positive, or making sure that people that may have had contact with these people are notified of that. Our health department has been very diligent. We're almost up to 50 people in the staff room. I liken it to a major investigation in law enforcement. They got to reach out and have contact with people that might have been infected by this virus. So the amount of work that's going into that is incredible right now. But understand this. If you get a call from the actual health department or health officials here in Macomb County, you need to answer the call. And when you answer that call, they're going to ask you some very basic information. They're not going to ask you anything about your finances or anything, just health-related issues, and give you some advice. But you need to give them, as much as you can of your time to help them better guide as to how they contain the actual spread of this virus. That's all they're going to call you for. When in doubt, if you want to hang up on somebody because you think it's somebody who's a scammer trying to get your finances, you can hang up, but you can call back the health department, whether it's because you want to help them out with their contact tracing, or because you have some other related issue or concern you may have. And the number to call here in Macomb County is 586-463-3750. Again, that number is 463-3750. Make sure you call that number if you have any questions or concerns or are confused with whether or not you should be talking to somebody because you think they might be a scammer. Now, with that being said, you'll notice that I just kind of went retro. It's not that because I wanted to come to work wearing jean on jean. In fact, my staff here today, when I brought this in, I wore it in, were looking at me kind of a little crazy, thinking, what's he doing here? The reason for it is because there's something going on right now that has gone retro. You notice this here happens to be my Lee jean jacket. It's from back in the day, back in the 1980s. In fact, if you zoom in on the actual logo here, you'll notice this is my jean jacket with McGruff, the crime-fighting dog. And McGruff was kind of iconic back in the day, trying to help us deal with crime prevention and trying to figure out how do we get people to realize, they need to own some personal responsibility in preventing themselves becoming the victims of crimes. The actual logo was designed in 1979, and 1980 is when they introduced it. And they said, basically in 2000s, they did a study, 9 out of 10 people knew who McGruff was. But that's not really the reason why I wanted you to look at the McGruff logo here. What I really wanted you to realize is we are going retro with some numbers. And I bring in Tony Wickersham, our sheriff here in Macomb County. And interesting enough, that's what we're seeing right now. I mean, I started in 1980. and our numbers have gone retro when it comes to the prisoner population here in Macomb County.
Just unbelievable that this morning at 2 a.m., we had 294 inmates in the Macomb County Jail. And we haven't seen numbers like that since the 70s.
And you think about that. I mean, those numbers, and the lowest you've had was, what was the lowest so far?
283 last week, on May 2nd was the lowest.
Possibly you're going to be riding some state prisoners out.
Yeah, we had an inspection on Friday by the Michigan Department of Corrections through the governor's executive order. They came on out, inspected our facility. We have 14 inmates that have been sentenced to prison. And through this inspection, we're very confident we met or exceeded what their recommendations are, and we're going to be able to transport 14 people to prison hopefully by the end of the week. So that number will go even lower.
Now, just to hesitate on that for a second, most people don't realize it. When somebody has been convicted of a crime and their case has been adjudicated and they're recognized as spending more than a year in jail, it's not a jail, they'll go to a prison, in the state prison. So the state, through an executive order, push back on any prisoners being sent to Jackson and or to the state. You've had to house them for a longer period of time than should have been necessary.
Yeah, one of the early executive orders roughly a month ago indicated that anybody being transferred to Michigan Department of Corrections, it was going to be put on hold at this point. They have their own issues within the prison system with the virus coming in and being spread out through the prison. But in the executive order, it gave sheriffs the opportunity of once every 7 days to contact the MDOC, have them come on out and inspect the facility. They're looking at our policies and procedures, our COVID response plan. They're looking at the housing aspect of it, and they come and they give you the okay that you can transport them. And again, my staff reported on Friday that everything seemed to be in place, and we're just going to wait for that report so we can transfer it.
And you guys have done an incredible job, from what I understand, as far as trying to contain the actual virus itself. I mean, the numbers are low. That's helpful. So now you can kind of spread them out a little bit better, and I got to imagine that's part of the policy. But being able to identify and, I guess, assess and deal with somebody who might have the virus has been a pretty good response.
Look, our WellPath is our healthcare provider inside the facility. They were ahead of the game. We started additional screening on February 9th. Even before this all started to take off. All new inmates coming in were asked additional questions, were screened, given additional examinations. Individuals that had signs, we were isolating them. And so we've been doing this since February 9th. And when things really started to take off, we set up those that have the symptoms. They're going in the medical unit. They're being isolated. They're being tested. Those that are tested are staying inside for 14 days. Once they're cleared, now we're moving them into a recovery area. So we don't want to introduce, the virus into the main aspect of the main part of the jail where many people are at. We're also, all new inmates are being screened. Because we have the room, we're able to house them separately, isolate them for 14 days, examine them, keep an eye on them. If they have no signs or symptoms, then we can move them to the next step.
And that's an upside to the less count, I guess, if you will, amongst many others.
Right.
But again, even the misnomer, some people are getting the impression that, whether it's in a jail or anywhere else, that people should be tested whether they show signs or symptoms or not. Every healthcare professional will tell you, okay, you can do that, try to determine whether somebody's asymptomatic. The question is, do we have enough tests to do that to begin with around the country? And the answer to that is no, there is not enough. So with that being said, even if somebody tests today, it doesn't mean that, by week's end, they're not going to have the virus or they're not going to test positive. So we go back to the reality that people are getting tested when they show some type of symptoms, and we are doing that, and they're even doing that in the jail.
And that's really the key. It's not, there's some jails that are testing everybody. We're separating them, we're isolating them, we're observing them, and if they're showing signs or symptoms, and again, that list of signs and symptoms has grown over from the start of the original COVID pandemic. But our healthcare staff and our staff, what we're really doing too is not only to protect the inmates in there, but I got to protect the staff that are dealing with these individuals. And when the MDOC says we don't want any prisoners unless we know things are, following proper protocol, they have that luxury. Right. Unfortunately, I don't have that luxury. Somebody gets arrested out on the street, I have to take them.
And they got to bring them in.
And we've got to bring them in. And we got to make sure we're doing everything we can to assure that they're not a COVID carrier. that they don't have any signs or symptoms, and that we're protecting our staff and those individuals that are working inside the jail on a daily basis.
It's a good sign. You kind of, their requirement, I got to believe, extremely strict and stringent as to whether or not they're going to finally accept the prisoners that they should be accepting from the county jails that have been remanded to their care and custody. So once they finally allow those prisoners to go over, that'll be a true testament to the work that's being done on behalf of not only your staff, but even the healthcare facility or the folks that are actually contracted to do that work.
Exactly. I mean, every day, as you know, these executive orders are changing and there's new information coming, whether it's from the health department or the CDC, and we have to be fluid. We have to adapt, we have to change, and we have to make sure we're following proper protocols.
Well, and good work with that. I mean, that's impressive. To get back to the retro aspect of this, the numbers, I think that's going to be studied for years to come as to how did this happen. I mean, as we mentioned before, I started in 1980. The numbers weren't that high to begin with. In fact, rehab was in 1976 when they brought that online, and the main tower was put in 1987. I was there well before that, and the prisoner population was only 372 back when I started in 1981.
Right.
And to think that here we're at numbers back from the 1960s, almost 50, 60 years ago, half a century ago, we're at that prisoner population. The big question becomes, why? What is this? And again, I think it was starting prior to the COVID crisis with some of this criminal justice reform.
We've talked many times about that, the reform. Things were definitely changing. We look back, the year 2000 to 2005. When you were sheriff, we were housing 1,500 inmates. We had overcrowding issues. We had to do releases. Then over the years, we were at the 1,200, and over the past 2 years, we've been under 1,000. And starting this year, January, we were 875. And look where we're at today. So things are definitely changing. I know COVID's playing a big role in inmates being released, whether their attorneys or the judges think that there may be an issue inside the facility and they want to err on the side of caution and give the individual either the tether, the bond, and getting them out and using other services that are available to them, or are they trying to give their courts the opportunity. Some of these cases, when they're in custody, they're on the clock. They have to be brought before the judge and they have to be heard, and they're working out some of the logistics there, talking about jury trials. How are they going to bring 200 people in and query them for a jury? So there's still a lot of work to be done on the criminal justice side, but this relatively low jail population has given us some direction and some ideas of where we might go into the future.
Yeah, and the reform part of it, I mean, you stop and you think about it. Back in the day when we talk about prisoner population being 1,500, we added, an annex over there for work release. It was almost like they were trying to punish people for their crimes, and I get that, I understand that. But the reality is, the number one reason to have a jail is for, public safety, making sure somebody isn't out there harming them in some kind of a physical way and or financial way. That's the other concern that we have. So that's, I think, the real need for confinement. But again, confinement should never be a substitute for treatment. And that's what we're finding. A lot of these people in the jail are there because of a substance abuse, mental health issue. And we're finding that the courts, as well as other areas of the criminal justice system, are becoming more receptive to that and saying, you know what? We need to figure out how do we better respond to that. And the numbers have been driven down as a result of that. Even this, having the public defender's office is going to be somewhat helpful in that regard. But we've got a lot of support and a lot of help out there in that regard. But again, this COVID crisis, wow, I'm telling you, I'm amazed at the numbers, and to see what happens over the years and how this gets studied and looked at as to, how this played out. And then what's going to happen after the crisis, over the next year or two starts to subside. Are the numbers really going to drive up that big? And I don't know if you believe they really are.
We believe that it's going to be a slow roll of things going back up. Again, now these individuals, if they're out on bond or out on tether, their cases may not be heard for maybe 3 to 6 months. The individuals that are incarcerated are going to, have their day in court and have their trials. I believe we're going to get back, but I don't think we won't get back to that 800 for maybe another year or two, if we do.
And on that note, real quick, on the numbers, interesting, because the question becomes out in society, the fact that we're a prisoner population is far less than what it was. We're not seeing a lot of crime out there in the neighborhoods or out in the communities either right now.
No, right now it's whether those criminals are a fear of the coronavirus themselves. The activity, the calls for service are really down. We hope that it stays that way. Yeah. But if not, we're prepared to get on out there and
Yeah, and I'll be interested to see how that study plays out. I'd love to be a part of that to try to make that determination, as well as what we're going to be doing with the jail moving forward too. We know we got rid of that request for a millage because we realized, you know what, now we get to move in another direction, hopefully one that's going to be much more financially suitable for the public. But again, as we always say, something that's going to be what is necessary to house prisoners in the county, and myself and Tony are going to continue to work on that. So in the meantime, I want to continue to offer you up the opportunity to go to macombgov.org for your information about what's happening here in Macomb County, and continue to keep you and your family safe. Thank you.